which is also the next question, something I know is near and dear to your heart. Why does homeless prevention matter?
I think we do know from research that exposure to homelessness for any length of time, I mean, there will be variation between individuals, but exposure to homelessness has profound and long-lasting impacts on people in a negative sense. So we know that health and mental health are compromised and worsen. People are more likely to experience trauma. People are more likely to experience things like brain injury. Um, People are more likely to be malnourished. There's a whole set of consequences in the health front. People are more likely to be victims of crime, exponentially more likely to be victims of crime. And the response to people are young people are like the sizable percentage wind up being trafficked and exploited. So a lot of negative things happen, and the longer someone experiences it, the deeper those problems can be, and the harder it will be to recover. And so all of that is to say that by letting people fall into homelessness and not helping them immediately exit, we are contributing to problems that they will accumulate and which may be really hard to handle. And our whole approach, I think, to you know the current what I call the new orthodoxy, right, which is about 20 years old, which is a combination of housing first, which is a great thing, community strategies to coordinate efforts to reduce and end homelessness. That's a great thing. And focus and prioritize chronically homeless people with complex mental health and addictions problems. That's important that we do that. But that bundle of activities, if you think about it, sets people up. We have to do better, right? Because what it means then is if you become homeless, before you get housing and supports, you have to wait. You have to get sicker before you qualify for housing and supports. It's an approach that flies in the face of the notion of the right to housing, and we're not having enough conversations about that in Canada. And the data from the United States is quite interesting. Um, I'm going off on this a bit without really talking about prevention, but
No,
it's
please do.
important. So this new orthodoxy has been around for 20 years, and so there's data. The Housing and Urban Development in the United States has an annual report to Congress, and the 2020 report had data from 2007 to 2019 or 2020 on chronicity, and showed that it went from around 115,000 people were chronically homeless in 2007, dropped down to around 75,000 or 80,000 by, in the next 10 years, and then ticked back up to 110,000. And we know why that happened. And that was because of a massive investment in housing first and supports for our veterans, where veteran homelessness was halved. And so it was reduced by about 37,000. The reason that worked is because the Veterans Affairs in the United States is its own integrated system, right? They have housing, they have health care, they have employment supports, they have a whole range, and it's an internal integrated system, which doesn't exist outside of Veterans Affairs. And so the question we have to ask then, after 20 years, is that new orthodoxy sufficient? And the evidence isn't there, right? And I feel like there's often a reluctance to talk about that. And so the problem then, if we flip it around, right, like rather than wait for people to get sick and to be homeless a long time, what if we tried to stop them from becoming homeless in the first place? And then they would avoid the consequences of exposure to homelessness. It would be less expensive for those who care about the cost. It would be better for those individuals better for their families, better for the communities. And we can do it. Like people wind up homeless because they're short on rent. Like that's a fixable problem. We discharge people from prison into homelessness knowing that the recidivism rate goes up. That's a problem we can solve. We discharge young people from child protection services. They age out or forced out at 18, 19, and are very likely to become homeless. These are problems we can solve. So it requires a reorienting of like, what is the problem that we're trying to solve? And if the problem we're trying to solve is ending homelessness, then we have to turn off the tap, turn off the inflow, intervene early. I think the pandemic gives us an important insight into the value of prevention. Imagine what if we treated the pandemic the way we treat homelessness. It would mean no social distancing, no personal protection equipment, no lockdowns, no vaccines. It'd be like, no, we can't afford that. What it would mean is building a giant emergency room, waiting room at the hospital, and then waiting for people to get really sick. And we all know that would be a horrible way to deal with the pandemic. It would be horrifying. But that's essentially what we're doing. We've created a system that waits for the bad thing to happen, and then waits for the person to suffer sufficiently. And then, not in every case, but then people may be eligible for help. We've got it upside down.